so we have a couple updates for you. We just went and got Lily's Librela shot. We do have some vegetables here. I don't think she's gonna want a green bean, but we'll try. Do you want a green bean? This one's greener than the other one. I don't think she's gonna want it. You don't want a green bean? How about this one? It's not quite as green. Do you want the less green bean? No. Okay, so yeah, because she didn't eat it last night. I don't know if she's gonna eat any of these, quite honestly. Sweet potato? She did eat. Are you sure? You're gonna spit that out. I knew it. She did eat them last night, all of it except for the green bean. And we did hear back about the vet heard back from the other vet hospital about the echocardiogram. So it's a lot more than the x-ray, kind of more than I was expecting. Basically, it's $400 plus tax for a consultation, which they'll do an exam in an hour and a half. If they decide that an echocardiogram is needed, it would be $975 plus tax. It's like $1,500 with tax probably, so it's going to be like, I think the quote for the x-ray was like $796 with tax, so it's like $700 more. A lot more, and it's like 40 minutes away, so I'm not even sure how I would get there. And then I asked about the sedation they would use. Okay, do you want a blueberry? I asked about the sedation they would use at... Okay, you don't swallow it. Jesus. You gotta chew it. Chew it. If we did the x-ray at the vet here, I asked what kind of sedation. Someone mentioned... oh, we're getting blueberry juice. It was actually Boo's mom mentioned that Bruce got something called, I think it was called dexdomitor. So I asked about that. She said they don't use that for generally for older dogs or for heart patients. So what they would be using is, she said it was like a 3 thing. So they refer to it as bag. One's to increase her heart rate, I believe. One's for pain, maybe, I don't know, and one's for sedation. They call it bag. Blueberry. So I guess instead of going to work tonight, I'm gonna go rob a bank. Because that's a lot of fucking money. I still have to like consider that after she finishes her antibiotics, that I need to get her at minimum a urinalysis. Preferably we need to get the urine culture, which is quite a bit more. I think it's 1.5 times the amount of the urinalysis. So it's all a lot of money. And then now we've got her on the amantadine, which is another $110 a month. I've been giving her urinary tract supplements again, which is starting to run low, which is $50 a bottle. And then her food is expensive. It's hundreds and hundreds of dollars a month currently. So it's a lot of money, and we are getting help and donations, which definitely helps, and I appreciate that so much. But it's a lot, and so I just don't know that we can do the echocardiogram. It's be hard enough just to come up with the money for the x-ray. So, okay, so she did walk a bit today, and it does seem like the last few days her breathing issue is back again. I'll say it's not as bad as it was like when it started, where the first time I noticed it, it was like 1 a.m. and within walking one house, she was tongue out. So today she walked with her cooling vest in. She walked up kind of like the catwalk and she was okay, and then across the street, and then her tongue came out. So it wasn't immediately that her tongue came out, but it is out much quicker than it was, say, a month ago, when in the summer with her cooling vest, she was able to walk 20 minutes easily, half hour without her tongue coming out. So it's definitely still, the issue is still present, but if she's not breathing heavy when she, it's a green bean. She's not breathing, oh, I forgot your snap peas. I forgot to cook you snap peas, I'm so sorry. She's not breathing heavy after she chews her bone anymore, which is good, I guess. Want some peas? She did eat some peas last night, too. One of them fell out. Do you not want the peas? Her appetite as far as her dog food has actually been really good the last... You don't want the peas? Yeah, her dog food appetite has been really good. Okay, so, but she's not been drinking, like, I don't know, maybe she drank a little bit of that, I don't know. In the past, she would come in from a walk and immediately go get a drink from the bowl, which she hasn't done in, I don't know, days or a couple weeks. I've been getting her to drink water with her food, so I've been, like, I don't know if you'd even call it soup, it's so watery. And it has seemed to be helping her urine, because I've noticed it's not as dark. So it's a clearer color, which is good. It means that she is staying hydrated, but it's only because I'm I'm getting her to drink with her dog food, which thankfully she is. Like last night, she actually, most of the meals lately, she's licked the bowl clean. So that's good. But she doesn't seem to want to drink just plain water out of her bowl lately, which is kind of concerning. Oh, I think one of these is that's a cantaloupe. You like cantaloupe. Yeah, you like the cantaloupe. And then we do have a little tiny piece of pineapple. Are you a fruit pug? Are you a fruit pug? Yeah, you're a fruit pug. Sometimes you're a vegetable pug, but apparently not this afternoon. No. Yeah, so I'm sure no one's surprised, for the 250th time, we are canceling the green bean channel. I'm sure it will be back, hopefully. But yeah, she didn't want it. She ate one yesterday and then denied the others, and then she didn't want any last night. I think that's about it, though.